emergencies can happen at any time. And we find that parents feel very helpless. When you do it right, and the way the child responds was very, satisfying. I looked after a child that was extremely sick, and it was one of those days where I had to transfer them, and and I thought that this child may not survive even the ambulance trip, but we ended up making a very successful trip, and the child did well. You just don't treat the child; you go beyond and treat the family as well.
How did you start that as an initiative, and what was the moment you felt, okay, this is something which I want to really drive forward in India, bringing simulation as an important part of the training for the doctors?
So I happened to chat up with him, and he said, "You know what, I'll get you to become a trainer." And so he trained me. And just after that training, I had to relocate to India. So I had the skills, I had the knowledge of how to do it. And when I looked around, there was nothing like, people, as I told you, there's a lot of myths about simulation, and they said that, you're using mannequins which are very expensive. They are like almost 40-50 lakhs, that expensive mannequins that are there. And people said, no, these are all like not for us. We learn on real patients. This is India, if mistakes happen, it's just about like, a matter of luck, these kind of things. And these myths were like very disturbing for me as a relocated clinician.
Or speaking to a 20-year-old or probably a medical student today. So, what is your message to them, right? Or probably upcoming generation into this field of pediatrics, and also simulation, or trying to make a meaningful change. So what would be your message to them?
I think the young generation doctors are very lucky. They have the infrastructure. They have fantastic, teaching modules, and they have the ability to learn all the skills. They have knowledge at their fingertips. You just have it in your smartphone, everything. You even have the AI now to guide you how to do things.
Yeah.
So they are very lucky.
And on the simulation is probably what gap were you aiming to fill in India's pediatric training landscape?
There are mentorship programs available, but annually we probably train about 80 doctors maybe in a year, and that's nothing compared to what is really, really needed. In such a high-stake industry, we are hardly like focusing on this practice.
Peter Weinstock, he said, "We are the only high-stakes industry that does not practice prior to game time."
Dr. Sujatha is the lead and head of Pediatric Intensive Care and Pediatric Emergency at the Aster Women and Children Hospital in Bangalore. She's also a fellow of the Royal College of Pediatrics and Child Health in United Kingdom. She's also a founding member, secretary and treasurer of PEDIStars India, the country's first pediatric simulation training network, and plays an active role in the International Pediatric Simulation Society, IPSS. Beyond her clinical leadership, she has been an examiner for MRC PCH, passionate teacher, and a researcher leading multi-center studies like the TRIP study on pediatric trauma. Her vision goes beyond the ICU. She's also the proprietor of IACT Fast Kids, an initiative that equips parents and schools with first aid skills to save lives. With over 2 decades of international experience across premier centers in the United Kingdom, including Sheffield's Children's Hospital, Birmingham Children's, and Evelina, she has brought world-class pediatric critical care expertise back to India. If you liked this conversation, please hit the like and subscribe button to get the latest updates from my channel, Caffelogue with Naga. If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we live. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going strong. Thank you.
A very warm welcome, Dr. Sujatha Thyagarajan. So I'm happy to have you in my show, Caffelogue with Naga. And I think today what we're going to talk is more of it will resonate with a lot of, not just the medical professional, but even a common man in terms of how, we can be of help when the situation arises, when there's an emergency. So I'm thrilled to have you, Doctor, part of my show, Caffelogue with Naga.
Thanks, Naga. It's a pleasure from my side as well. I'm just curious to know how we can like touch the lives of the common man apart from the regular patients that we take care of.
So I think I've researched about you, and when I started looking at what you're doing, especially from India, and also contributing to the International Society of the Simulation. So probably, and on your, I mean, it's an important area. The field where you're in, it is much more very critical care and critical care, and it's an emergency care, right? So that's a very demanding area to be in. So I want to understand how you got into, why you chose the pediatric critical care as a specialty, and also your interest on bringing a lot of simulation in that area to India. So maybe walk us through your journey, doctor.
Okay, wonderful. So, as you all know, okay, emergencies can happen at any time. And we find that parents feel very helpless. Okay, as a doctor, as a pediatrician, when I trained, I found that, this vulnerability and there is a need. It requires a special personality for you to like equip yourself to handle this. And when I was a trainee, I found that, the routine care, I was able to very comfortably do it. But when it came to emergencies, it required like quick thinking, compassion, empathy, and also, making sure that you have a set process and you see the response and you know how to evaluate. It required a lot of focus. And when you do it right, and the way the child responds was very, satisfying. So I thought I should be doing more of it. And the more I did, the more I learned how to do it right. And like, how when I don't do it right, how it impacts. So that's how I got into pediatric critical care. And I realized that it's one of the niche specialties. And the more I did it, the more I adapted towards what was required of me. So that's how I went into pediatric critical care. So that's my journey from my training, where I looked after sick children, got the amazing satisfaction, and then refining it, and re-refining it. That's where I am.
All right, I think it's a probably it's a great journey when you actually touching lives. I mean, medicine itself is a very profession which I really, I mean, everyone respects, but I also have very great respect for healthcare professionals and doctors and surgeons who are constantly saving lives and trying to touch many lives and families, right? So, and especially with children newborn, and it's a very delicate situations when you actually handle them. I think any specific moment you think, okay, okay, hey, the satisfaction during your journey which has shaped your career as well. So do you want to call out or talk about that?
There are many such moments that make me feel very satisfied when I get it right. But of note, maybe when I started in my training, I looked after like a very sick. I trained in the UK, and my first step was to make sure that we learn the steps. There are various courses that train doctors on how to handle emergencies, but you learn it in the course, and when you actually do it on a real patient and how you see that change. So I looked after a very sick, what is called a meningococcal septic shock. And that's probably a nightmare of an emergency for any pediatrician or any clinician. And unless you get all the steps right at the right time, you make a big difference in the outcomes. And I looked after a child that was extremely sick. And, it was one of those days where I had to transfer them. And, and I thought that this child may not survive even the ambulance trip, but we ended up making a very successful trip and the child did well. And when the child was getting discharged, the family just kind of got back to me and thanked me like anything. And I thought, oh, I just did my job, but it impacts this family to this extent. That was the one that like made me realize that you just don't treat the child, you go beyond and treat the family as well. So that was one of the like life changing moments when I decided to do intensive care. And if I look back, having been a trainee, and recently I looked after a child in my own hospital at Aster Whitefield. And this child came in like comatose. And we didn't have a reason as to why this child, who was like playing and doing everything, just suddenly became comatose. So we had to go through a few series of tests and then give the treatment. So a child that came so sick, and then within a month he needed PICU care for nearly a month, and we had to like escalate all the care, give various medications that include fighting the immune system. And after all these therapies, which are available in very few select centers and requires a very curated and personalized approach, this child is now going to school. So this family, like on September 6th, came back and they gave a very nice appreciative certificate, which is all framed, naming every single doctor and nurse that was there in our unit. It's very satisfying. And the father's, expression of gratitude, was just very pleasing,
I think some
So,
difficult to put into words.
correct, yeah. So it's
Yeah,
a everyday experience for us, and that's what drives us.
yeah. I think critical care. I mean, it's a lot of people feel overwhelmed with the amount of demand and the trauma you see there, especially on the children, right? But I think people like you who are trying to take that as a challenge and trying to contribute and help, right? I think there's kudos to people in critical care across, and especially on the pediatric critical care, right? As you say, it's a life-changing moment. It's very fraction of seconds. Anything can happen. It's an immediate. The time span you have to actually attend is also like so. Every second counts. So that's a very very powerful place to be in. Thank you so much.
And the space of responsibility.
Yeah, yeah, that's
Yeah.
true. Thank you for
It's a privilege and also a responsibility.
true. So I think from there to I mean I wanted to again let's say before we go into IPSS and also the simulation part of it, maybe um, uh, before we deep dive, one fun fact about you most people don't know if you want to share. So we start with something light, or because people have seen you in emergency situations, but I know maybe you that's not a place to be more fun. But I think but anybody who wants to know Sujatha which they have not seen, and you want to start with that.
I was just going to say I'm like an open book most of the time,
Yeah.
very predictable behavior all the time. Uh, but probably what people know, or maybe they don't know, is that, when I say something, I mean it. And when it's a joke, it's always a joke.
All right. So you've been deeply involved with PediStars and IPSS, and I know there are a lot of I mean it's even for me when I started looked at the especially on the field of simulation and why it is required and how it helps the doctors, and it's a very eye opening kind of a I mean for me I know there was these simulation centers and mannequins and exist, but I think how much of the impact it is actually doing to the medical society and also the doctors, that's pretty eye opening for me to even learn. So I thought, how did you start that as an initiative, and how what was the moment you felt, okay, hey, this is something which I want to really drive forward in India, and in bringing simulation as an important part of the training for the doctors.
Thank you for that question. So, when I was in the UK and I trained, simulation probably started like, becoming part of the mainstream education, especially for critical care, maybe around 2007, 8,
Hmm.
something like that. And then it became a little bit more like structured, probably by like around 2011, 12. And I happened to look after a patient who was like the child of a simulation director in my hospital in London. And I was in the process of learning how to set up a PICU because I was anyway planning to relocate to India. And when I was doing all of that, I went through some simulation drills and everything. But I wasn't quite sure how structured I was doing it. So I happened to chat up with him. And he said, you know what, I'll get you to become a trainer. And so he trained me. And just after that training, I had to relocate to India. So I had the skills, I had the knowledge of how to do it. But when I came to India, I realized that, there were a lot of, myths about simulation. The thought was there are something called life support courses that happen, and people always thought that these life support courses are enough and that is what is simulation. So we have something called the PALS, which is the Pediatric Advanced Life Support. So they thought you just do that, you're an instructor there, that means you know simulation. And that's how they thought. And it was a very, very narrow approach, which I thought. So when I came back, I found that even in my day-to-day practice, there were so many things that which were more like what we call non-technical skills or human factors that actually defines the way we care. Some simple examples for, you make a plan after your ward rounds, and then you expect, like, you communicate that to your team around you. And when they nod, you know that they have understood. That's a non-verbal method of understanding, is my presumption. And then when you step out and you come back, hardly like 10 or 20% would have been implemented. And you keep wondering, well, is there a reason why these were not done? And then there's always being like that nod, and you just kind of assume what is going on. So I struggled quite a lot, especially because I was in the UK for 14 years. And when I came back to India, I just couldn't readjust to this. And, and there's like a work ethic, which is there in the West, which is like, very professional. You make a plan, you complete that, you talk back and you say, yes, this is done. And that's the work ethic. And we didn't have that here at that time when I came. And I struggled quite a lot to understand why this was happening. So I thought that probably we should be doing something structured in such a way. And when I looked around, there was nothing like, people, as I told you, there's a lot of myths about simulation. And they said that, you're using mannequins, which are very expensive. They are like almost, 40, 50 lakhs, that expensive mannequins that are there. And people said, no, these are all like not for us. We learn on real patients. This is India. you know if mistakes happen, it's just about like a matter of luck, these kind of things. And these myths were like very disturbing for me as a relocated clinician. And I thought that I need to like really focus on this and contribute something on our own. So I had a couple of very good friends whom I kind of connected. And so that's how we started PEDIStars. So the aim was not to just one, to like train the workforce so that there's a structured way of doing things, and focus on the human factors so that we improve that aspect of care, rather than just like medically we are all trained, we know we have to give this nebulization or this medication or this antibiotic, but do I know how to give it? Do I have a process of cross checking? How do I ensure that I've given the medication to the right person at the right dose at the right time? Who's there to follow me up? Who's there to track me? How do I ensure that this has happened? So those type of things need a lot of refining, and simulation is one of the best ways to do it. So that's how we ended up starting this PEDIStars. The aim was to initially kind of deliver a little bit of confidence to the competence, and to improve that competence as well through simulation. So that's how we ended up starting PEDIStars. And then we had a lot of global collaboration with two such societies called Society of Simulation in Healthcare. They've been doing it for many years, and they do interprofessional training and everything. So it was a good collaboration to have. And also the IPSS, I think that was like in the nascent phases of becoming an international society. So we grew with them together. Let's put it that way.
Okay, that's
Yeah.
great.
So
So,
that's the reason how we got simulation into India.
okay, that's I mean, always there is some purpose. I think something comes to people who want to make that change, which is very important from a critical care standpoint. I know where it was lacking. I think the conviction you had to bring that along with the other doctors to in India, which was very, very interesting to know. I mean, something which I think I think I saw one of your conversation where you were talking about, you start with a pillow. So I think it's about not thinking about, okay, hey, I don't have anything. How do I start? In terms of, okay, how do I start with what I have? So that's also a different perspective to look at, right? So it requires a maturity and also the thought process of, okay, how do I leverage best of what resources I have, and then try to do contribute back to the place where I am. So which is very, very compelling, and kudos to you to beginning get that started. And a lot of people don't know PEDISTARS, so maybe am I right or not? It's Pediatric Simulation Training Academy and Research. If I'm
Training and Research Society.
research, okay. So
PARS
it's
is like an acronym. Yeah.
yeah,
Pediatric, yeah.
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 Got it. So I think it's so the main objective of this PEDISTARS is to actually enable the healthcare professionals in terms of bringing the simulation-based training, which is more structured, and also they improve their competence, as you talked about, and give confidence for them when they're handling those situations when the time arises, or when the real patients. So basically, it's far from harming the patients, but trying to be making sure that they are ready, if I
Yeah.
summarized.
And actually, over there, so PEDISTARS is like it started in 2013, but informally, probably from 2012 itself. So the work was on, and we're nearly like in our 12th year now.
Wow.
And over the years, we have refined and learned a lot from what's the best way to deliver. And we're not using pillows anymore. We are having all the low cost resources, and with what we have, we bring out the realism. And I'm very pleased to say that probably we are the global leaders now, in just like we are the youngest society in the world, but we are like the foremost torchbearers of how to use low cost resources and bring the highest realism, and then improve the patient care, because we conduct simulation in the place of care.
Right.
So it's called in situ simulation. And through that, we like bring about system changes, we bring about process changes. And as we are now focusing on our research, so hopefully in the next couple of years, we'll have plenty of research of how we have impacted patient care, component by component, and how we have like brought about the change in outcomes, maybe in emergency, maybe in intensive care. Okay, so that's how we are progressing over the years.
If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we live. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going strong. Thank you.
Great. I think I also note I listened to some of the IPSS sessions as well, in preparation to this conversation for a while. So I think Peter Weinstock, one of the session, he talked about the growth of IPSS too, from 2000 to where it is now, and I think the statement what he mentioned was very, very, very powerful. I think he said we are the only high stakes industry that does not practice prior to game time.
Absolutely, absolutely. He nailed it.
Yeah.
He just nailed it. And he's one of our mentors for PEDISTARS, and a very good friend for us as well. And yes, we follow that to the point. And it's staggering. It is absolutely staggering to believe that, we live in a world where in such a high stake industry, we are hardly like focusing on this practice. To be a Virat Kohli, how many
Yes.
net balls he has faced. To be a Sachin Tendulkar, we have that practice. It's the years of experience before going for the big game. And that's what defines a champion. And why is it that we are so lax? We may know the technique of doing things, but have we tested ourselves? Can you imagine flying a plane,
Yeah.
without having enough sim
Flying art
experience?
training. Yes.
It's just unbelievable. And how is it that we're playing with life every single moment? How is it that we can do it? So I almost believe that simulation is ethical. It's in fact unethical that you go and practice on the patient, or practice on the patient without having enough sim experience. I
True.
think now in India, education has taken on a different take. And we have actually got our medical councils of India, nursing councils investing a lot on simulation for doctors and nurses. So that's already there now.
Hmm.
Only thing is, we don't have enough faculty who know how to capitalize and make sure that we are like, working to the fullest potential of simulation to bring about that change. But we have already made the waves and it's already started. Government has recognized it, medical councils, nursing councils have recognized it, but we still have a long way to make it perfect.
Yeah.
Still have a long.
I think this was the statement he started with, and then he said, how it has become, how the solution is to have a realistic simulation-based training and high-quality facilitation. That was the objective, he talked about. And I think, as you say, they've also evolved last 20 years, and then PEDIStars probably in the midway has also grown. I mean, it is, and he also mentioned about how it was more of the fund was also not really from the hospital budgets, even in US, right? It was more of philanthropy, which was driving for a while until 2011 or so, and then slowly from 9 or later, it is actually the hospitals realized that they need to allocate budget to actually do simulation, and then it was probably started happening. So I mean, as you say, in India, government is also encouraging and trying to help, which is commendable. It is good to hear. And if you are while we move to the next set of questions on the critical care and simulations, I wanted to if you are speaking to a 20-year-old or probably a medical student today, so I mean, what is your message to them, right? Or probably upcoming generation into this field of pediatrics, and also simulation, or trying to make a meaningful change. So what would be your message to them?
Yeah, I think the young generation doctors are very lucky. They have the infrastructure. They have fantastic, teaching modules, and they have the ability to learn all the skills. For example, you want to learn how to put an IV cannula, you can practice it in the mannequin, practice till you get it perfect. And then once you've refined your technique, then you go and try it on your patient. But you already know the know-how. You will cause less harm to your patients. You probably cause less discomfort, but you're more confident in approaching the right way.
Right.
Having said that all, so they are very lucky. They have the technology, they have knowledge at their fingertips. You just have it in your smartphone, everything. You even have the AI now to
Yes.
guide you how to do things.
Yeah.
So they are very lucky. But at the same time, it
The
comes with
effort,
a
right?
correct. You need to understand why simulation is important. You need to dedicate your hours. You need to make sure that you, perfect your skills, your craft before you approach the patient. And remember, that is the only ethical way of doing it right. Okay, so learn them. And, but I just want to give a word of caution. Okay. It's not all about the skills. So simulation is all about, getting the 360s right. So
Right.
it's important that we have a good package of facilitators also. And that is a big
Hmm.
gap right now.
Right.
Governments and institutions, because there is a rule to put the simulation lab, otherwise you won't get permission. People have invested lakhs and crores into all these simulation labs, but they have not had the same vigor to actually facilitate the facilitators, the teachers, the professors, everybody need training. I think that when that becomes mandatory and they're doing it in a psychologically safe way with the spirit of simulation in mind, then only we have reached out to our youngsters successfully. So
Got
that's
it.
still a pending responsibility.
True, I think very well said, ma'am. It is while the infrastructure can be there, but then unless you have the qualified people to actually spread that knowledge, it's difficult for anybody to learn. So yeah, I think more trained trainers, kind of people like you doing that would help enable much more people to come forward. All right. Yeah, I think he also, I mean, the IPSS, when I looked at how they've also done it, is I think I would say, organization goes through that process of building blocks, slowly, step by step. So I think we are at that stage in terms of bringing more facilitators, I would say, to take this forward.
I was just going to add one word about philanthropy, that they had the luxury of it and their hospitals invest in it. We still have a so-so, as I told you, that they have invested in the infrastructure, but not on the, not on the facilitation and then the upkeep of it. Many mannequins are expensive, so half of them are just staying in the cupboard. So I call it a sim morgue. Okay, we have a long way to go. We have a long way to go in India.
But how do you think the facilitation part of it? Maybe that is one more question I had. Like the first question on the simulation is probably what gap were you aiming to fill in India's pediatric training landscape? I think you covered that by your answer. But how do you think we can improve the training part of it, or bringing a lot of facilitators? Do you see it's more of not many are coming forward in terms of training, or is it probably not many fully sophisticated programs available for people to actually go into it? Or I mean, or is it not part of the curriculum itself when the the students are studying medicine? So where the gap?
Correct. Yeah. That's a good question. Actually, it's a combination of all. Okay. Just like anything, like for example, you have AI, that's the new kid in the block. And then suddenly all the like traditionally trained engineers have now to step up their gear. And it takes time. Okay. You may have some naysayers and you may have like some people like, wanting to do it. And there's like multiple options of what to learn, how much to learn, and how is it going to be useful. Just like that, we have the same situation with simulation right now. We have facilitators who are, especially there are traditional teachers who have certain methods of doing things, and then like, adapting to simulation, and then adapting to teaching the new generation of doctors. So there's a long, that gap is there, and that gap needs to be filled. There are mentorship programs available, but annually we probably train about 80 doctors maybe in a year, and that's nothing compared to what is really really needed. And so we are like in the process of building the capacity of mentors through PEDIStars, and we have a very very vigorous and highly curated mentorship program and faculty development program in PEDIStars, which is very very sought after. Probably, and I would claim very shamelessly also, and with pride, that probably it is one of the best programs globally, and there is a lot of respect for people who have trained through the FDP of PEDIStars globally. Okay, it requires a lot of personal time. Almost every other evening of it is
Right, that's
spent
true.
to train them, and we do it free of cost. We do it only for the passion of our country. And there are a lot of people in PEDIStars who do it voluntarily. That's the unpaid work, but that's done with immense satisfaction as well. We're building the capacity of such volunteers to help us out.
Yeah, I think it's, I mean, how you ended, it's through volunteering. Yeah. Facilitation is, and training and putting that effort is a major, you said that's a gap which we need to really address for us to take the simulation forward in India. I know what I was saying is, training any new, let's say, even in an organization, in a corporate setup also, if you hire somebody, let's say, like take, for example, AI for that matter, the amount of effort the experienced professional has to spend, definitely you need to dedicate some amount of effort monthly to actually bring those new people, or you bring that whole organization into more AI enabled, or any new technology you bring in. Similarly for simulation, for that matter, if you have to train them. But um, because it's more of a volunteering effort, and maybe it becomes a service, do you think the institutionalizing that as a more of a monetary, if you have a monetary benefit associated to, in terms of people who contribute for train so many simulation based experience for the new students, do you think that would change the game and bring much more rigor from a from improving the facilitation standpoint?
Yeah, I would agree with you. So I think hopefully one fine day it'll all happen. We're still not there yet. We're still in the nourishing phase, but hopefully one day it'll all happen.
Okay, but how does the other places, the uh, training, the facilitation is being structured? Is it also it's part of the curriculum in the education itself, or they do it once they get into the hospitals and then they get trained in parallel when they're doing the job? So how do you think it's addressed, or how do you think India should take that forward?
I mean, that's a very interesting question because globally, okay, they dedicate, for example, so simulation is treated like a specialty of its own, and there's a dedicated set of people, and they just work on that. If people can't dedicate and we cannot train everybody, at least we need to have some group of people who can, like, dedicate some work and time towards it so they can just do this, okay? So maybe that's one way of doing it. So you have like a sim director and then the sim responsible person, to conduct all these programs, and they have an accountability, and they have a way to like support, not just so you may be lucky to have a very good sim center, and then you try to support your nearby hospitals or like other medical colleges to like help them out to train. So there are many ways of getting it done. Probably we need to look at a combination of things. And as you say, incentivizing it is very difficult. We are clinicians first. We enjoy only when we are with our patient's bedside to see that like
Right.
real, a real effect. So to actually get persons to like dedicate to simulation is very difficult.
Difficult, yeah.
But having some dedicated sessions
Hmm.
in SimLab or for Sim program, as we say, that will be probably a way forward where you get a mix of both. So more probably we should be working towards that. There are
So,
some centers in India already working
okay,
towards that.
okay,
And
okay.
that's a good relief actually. They are the ones who are leading this simulation across India.
Nice. I think something like this, it's very difficult to digest that, something of this sort, which is very critical from a medical field standpoint, is not really looked at as an important, or probably, as you say, the gap of training or bringing more facilitation is very disturbing to know, right? It's not supposed to be that way, but we are at that juncture. But hopefully, as you say, there's not many aware people are talking about it, and probably it's awareness is getting created, and there is going to be more structured approach going forward. Okay, my next question is on any such story do you want to talk about, like from a simulation, from you started to now, from the time you started to now, like okay, any uh, personally you have gone through this, because of this simulation training which I've done, I'm able to actually, this case which I've got today, I'm able to resolve it much more, in a better way. If I've not had it, probably I would have done a trial and error. Or you've seen the students you've mentored, or probably somebody who has taken that and they come and talk to you about, hey, this is really helped today in saving a life. Any such examples you want to talk about?
Thanks for that. So basically, probably in the last 12 years, I've probably mentored quite a few people. And there's always an acknowledgement by many of our, like, people who are associated with us. And there's a culture of, supporting each other. So over the last couple of years, whatever we have done has always looked at how you make a change. It may be some simple things like how you communicate with the families. I'll give you one example of something that touched my heart the most. You may recollect a couple of years ago, there was a young intern who was brutally stabbed and killed in Kerala
Hmm.
by, by a prisoner who was there, brought to emergency. And there were many medical, like her co-interns who had to like take her out of that place and then try and save her life. And it was one of the most gruesome experience. It just knocked off the confidence of many young doctors in Kerala at
Yeah.
that time. I had to go and conduct a step workshop, which we do, which is like emergency preparedness through simulation that we do for all the young pediatricians. So, in that, we have one session on how to break the bad news or how to communicate with families. So we have a certain protocol on how to do it, how to keep yourself safe, how to make sure that you break it in stages, and what are the rules, what are the do's and don'ts, and we make them practice it, as part of this simulation. So when we actually conducted that session, or when I went for that, my colleague in Kerala told that many students are like, the participants who are attending this are looking forward to actually this session, and I want you to take the responsibility of making sure that they feel confident at the end of this session. And that was a very personally touching experience for me at that time, and I took it seriously enough. And then we went through like how to do it. We made sure that they practiced enough, they felt safe. A week later, okay, a week later, one of the doctors in Kerala actually messaged me to say, "Ma'am, I had this experience of handling and breaking the news. I followed every step that was taught to me. And I just wanted to let you know that, I'm not feeling that unsafe anymore. I feel more confident and I feel like I can handle the situation better." That was a very touching feedback I've ever had so far, and it was a time when our doctors needed that confidence. Okay. We have focused on this as part of our like faculty development program. Every time we make sure that check in your own place whether you have a space where you can sit down, where the doctors feel safe, there's a CCTV, you have an escape door. If there's a mob, there's security available, the police know how to help. Each and everything we take a lot of importance to, so that is very important. Yeah, that's one of my like most memorable feedback I've ever had.
No, I think it's good to, I mean, the more satisfaction is when you actually hear that somebody has been able to, I mean, use the knowledge or, probably what they've gained through some sessions, right? Again, practically, that is very, very important. Again, as you said, one thing which I noticed from the way you're saying, right? If I have to comprehend, a lot of times people forget that the human emotion which goes through for a doctor. Because the other side of, they're already in that trauma situation, right? The expectation is always that, okay, fine, I go to the hospital and the doctor is there in front of me, so probably everything is taken care. So, but there is a human mind which actually goes through that. As you say, I'm point was very, very powerful, that I feel safe to actually handle this situation going forward, right? Which is very important. I mean, the amount of mental, probably, I would say, trauma or dilemma which any doctor will go through when the patient comes to the hospital, or let's say especially on an emergency situation like that. It is very, very. I mean, you cannot put words to it, or probably nobody else know unless you are in that position, right? So this training is going to clear up a lot of that uncertainty for them to handle such situations in much more confident way. So yeah, I think very, very. I mean, I'm just trying to process some of the important points you said.
I'm just going to highlight one point there, which is basically, one of the things that we are highlighting on is like how to communicate with empathy.
Hmm.
Because I think right now we are like really focusing on, it's not just about like, knowing that this blood pressure is low and I have given this medication and I've fixed this blood pressure. Okay. It's much beyond that. And you go and tell the parent that, okay, I fixed this blood pressure. They're not going to appreciate it. It's how
Hmm.
you tell. and that part of it. So there's something called AETCOM, that is like, how you actually do your communication through empathy. And that is something that is mandatory for all the sim scenarios that we do. And we always have like a embedded participant, who is acting at the role of a parent, who we make sure that, apart from you trying to like sort out all the medical problems, you also handle how you communicate with your team,
Right.
and how to communicate with the family. There's always one scenario there like that. It's absolutely part of the scenario of how you handle with empathy. So that is something that we have made it mandatory in our training.
Yeah, I
In
think
a
it's applicable for both sides, I would say, because a lot of times I've seen that as a worried parent, or probably any patient's family, they get a bit aggressive, or because they want something for their family, the person who is actually there, but then it becomes much more challenging to address. So I think, yeah, those training, as you say, would help to calm themselves as well as the family, to see how the communication can be much more smooth. I think it's a lot of times I think you would face in a critical emergency situation in terms of the on a day-to-day basis. Yeah, I think it's very I was assuming in general, right? before I when I was trying to research for this discussion, or prior to that, my thought was these are some things which is part of the education when you study medicine. But I think it's more of an implicitly thought that way, because it's just generally. But as you say, these are very, very important life skills to learn, not from just book, but how do you teach to the students who are upcoming doctors, or even the doctors who are already there, like nutrition as an example. It's been talked about for the last so many years that nutrition is not part of the medicine, but then today a lot of awareness is created in terms of understanding, and how it is an important aspect of education. But it's like this is like that is at least not a very well, it is important, but not a life-saving, I would say. But this is like an important topic for everybody to get educated. So I hope people like you creating much more awareness will help that bridge that gap.
You're right in thinking that, so basically communication skills is something that is not, that used to be not part of the thing that is tested. And now in most of the postgraduate training, communication is a mandatory station, and that's a good start. People learn how to communicate,
Yeah.
and that is tested and marked as well now as part of your postgraduate exams.
Yeah.
So unless you pass your communication station, you will not get through to become a postgraduate doctor.
I think
Now it is
I think over the
very,
period, yes, they understand. I mean, education as a field itself is evolving every year, and then every generation when they're studying, because what I've studied with my daughter studying is completely different at that age. So from a medical education standpoint, also it is more of the continuously updating to make it more relevant. So which is very important. Thank you, doctor, for sharing that. Human, we are born with empathy, but then a lot of times we don't show in the real situation that there is a need. But we are probably isolated still because of the technology, because nobody talks. I think she said today's generation, be it teenagers or even somebody who's in a relationship or getting into in their 20s, and there's a question asking her, what is the one important skill they have to learn? And she said communication skills.
no, that's something that I am facing day in and day out. And we like want to know how to communicate with these adolescents who are troubled in their mind, especially they have a suicidal risk and things like that. And we just, we don't get any verbal answers. There's hardly any eye contact, and there's just a shrug for every question. So it's very difficult.
And I think my question is also on the doctors, right? Like, because of this, the current generation coming with all these available tools too is also a stressful situation. You see that is impacting in terms of the practice, because you said one is to process the communication skills or manage their emotions, but beyond that, this is also like an impact you see in this, or that's helping.
No, I'm actually very jealous of the new gen doctors, because
If you made it this far, You're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we live. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going strong. If you liked this conversation, please hit the like and subscribe button to get the latest updates from my channel, Caffelogue with Naga. Thank you so much.